For most of history, children were not protected patients. They were convenient ones. They were small. They were powerless. They depended on adults to speak for them. And in hospitals, orphanages, schools, and institutions, doctors saw something else: test subjects. This is not the story of one experiment. It is the story of a mindset, a belief that children, especially poor children, orphan children, institutionalized children, could be used in the name of science, not because they volunteered, not because they understood, but because they could not refuse. For centuries, medicine advanced without rules. There were no ethics boards, no consent forms, no requirement to explain risks. Doctors decided what was acceptable, and children were often the easiest to decide for. Orphanages became laboratories. Hospitals became testing grounds. Institutions became places where suffering could be measured. Children in these places were described as unclaimed, incurable, or already damaged. That language mattered, because once a child was labeled that way, the experiment no longer felt cruel. It felt efficient. In the 19th and early 20th centuries, medical science was obsessed with observation. Doctors wanted to see what would happen. What would happen if a disease ran its full course? What would happen if a treatment was delayed? What would happen if a body was pushed to its limits? Adults resisted. Parents asked questions. Children could not. Many of the experiments were justified as treatment. Others were justified as education. Some were justified as unavoidable. But the common thread was always the same. The child did not choose. In many orphanages, children were used to test nutrition theories. Doctors restricted diets to study deficiency diseases. They withheld vitamins to observe symptoms. They measured growth, weakness, and mental decline as data. When children became sick, that sickness was recorded, not prevented. In institutions for children with disabilities, doctors believed they had found the perfect population. The children were isolated. Their lives were already controlled. Their suffering could be contained. Some experiments involved exposure to disease. Children were deliberately infected so doctors could observe transmission, symptoms, and recovery. If the child survived, the experiment was considered a success. If the child did not, the data was still useful. Consent was rarely discussed. When it was obtained from administrators, not from parents, and never from the children themselves. The justification was simple. The knowledge gained would help others. This logic appeared again and again. Children were exposed to illnesses to test vaccines. Children were given experimental treatments never tested on adults. Children were subjected to procedures doctors would not risk on themselves. In some hospitals, newborns were separated from mothers to observe infection rates. In others, children were intentionally denied care to see how long they would survive without it. These were not rogue doctors working in secret. These were respected institutions. Published studies, professional journals, academic approval. Entire careers were built on the results. The most disturbing part is how ordinary it all seemed. Doctors described these experiments in calm, clinical language. They spoke of subjects, not children. They wrote about outcomes, not lives. The suffering was not denied. It was simply reframed. Pain became progress. Death became data. In many cases, parents were never informed. In others, they were told the treatment was necessary. Some were told participation was mandatory. And many of the children involved did not have parents at all. They belonged to the system. As the 20th century progressed, the scale of experimentation increased. Advances in medicine created new opportunities, new vaccines, new drugs, new theories. And children remained the preferred test population. They were seen as adaptable, resilient, replaceable. Even when doctors began to understand the risks, experiments continued. Because stopping would mean admitting something unthinkable. That children had been harmed deliberately. That progress had come at their expense. That science had crossed a line it could not undo. In some cases, doctors believed they were helping. In others, they believed the children were already doomed. In all cases, the children paid the price. It was not until the mid-20th century that public awareness began to catch up. Scandals emerged, documents surfaced, survivors spoke. People learned that children had been infected, deprived, experimented on, without consent and without protection. The reaction was outrage. But the experiments were already over. The damage had already been done. New rules were written. Ethics boards were created. Consent became mandatory. Children were finally recognized as requiring special protection. Not because medicine suddenly became moral, but because the cost of ignoring morality had become impossible to hide. The history of medical experimentation on children is uncomfortable for a reason. It forces us to confront a truth we would rather avoid. Progress is not always humane. Authority does not guarantee compassion. And science, without limits, does not stop itself. The children in these experiments were not heroes. They were not volunteers. They were not martyrs. They were simply children who trusted adults and were failed by them. Their suffering did not make headlines. Their names were rarely recorded. Their lives were reduced to footnotes. And yet, modern medicine stands on the knowledge gained from their pain. That is the legacy. Not just innovation, but a debt paid by those who never had a choice.
Be a stranger than you think. From forgotten battles to bizarre inventions, we uncover the stories that make you say, "What the history?"